Well, it is a pleasure to be here, and it's so fun to be hanging out with Sam again. He and I had some fun times, and some not so fun times too. It was a crazy deal back in the late '80s, early '90s. Oh, you're welcome. That's great. Well, I'll just start. You know, the interesting thing, there's this 2007, it's also true in 2008 and 2009. You have this report to Congress on the benefits and costs of federal regulations and unfunded mandates on state, local, and tribal units. And a very fascinating thing, when you actually get down and look in that study carefully, what you learn is that the OMB, the Office of Management and Budget, estimates that the largest benefits of all federal regulations were attributable to controlling for exposure to a single air pollutant, PM 2.5. And in fact, depending upon how you play the game, about 70% of all the benefits of all federal regulations come from controlling this pollutant. Stunning, isn't it? Now, basically what they've done is they've tried to estimate what would have happened had we not controlled PM 2.5, sort of a counterfactual, and look at what happened as we have controlled PM 2.5. And they estimate the benefits, I mean, they don't estimate them with certainty, but estimate the benefits to be somewhere between 20 and $167 billion per year. Now, this doesn't come at no cost. The costs are about $7 billion per year. But look, think of that. We're getting very, very large benefits from controlling air pollution across the nation. And Jaron's talked a lot about the improvements that we've made. And what I'm going to focus on is the health benefits that really have come from doing that, and the health benefits that will come from continuing our efforts to control our air pollution nationally, but more specifically in here along the Wasatch Front in Utah. Jaron's talked about, he's shown basically that slide, talked about this. Here's my picture of a human hair. All right. Kind of fun. His point about these being really tiny, I mean, here's a human hair about 60 micrometers in diameter, and you can see these PM 2.5 particles or whatever. Here's my photo of air pollution. This is actually drawn from an industrial area in the UK, but nonetheless, the width of this whole slide is only about a half the width of a human hair. And these particles, you can see, the biggest particles here are about 2.5 micrometers in diameter. The rest, an inversion period, and it looks ugly like this. It's not clean air. It is very bad air. It's unhealthy air. Now, how do we know about the health effects of air pollution? Well, there's a long history on studying the health effects of air pollution, and it's very clear that humans were affected by air pollution even in prehistoric times. Living in caves, building fires in caves to stay warm result in a lot of pollution in those caves, and there's evidence that this was causing sinusitis and respiratory ailments in prehistoric humans. But in more modern times, probably the story began maybe in Meuse Valley, Belgium in December 1930. This is an industrial valley, had an inversion, clamped down or put a lid on the valley. The concentrations of pollution got high. They had 60 deaths, 10 times the normal during a 4 or 5 day pollution episode. come closer to home, this is Donora, Pennsylvania, an industrial valley on this bend of the Monongahela River near Pittsburgh. They had zinc plants, steel mills. During inversions, it would trap the pollution in the river valley between the buttes and the bluffs of that Donora area. They had a horrendous episode that occurred in October of 1948. This is actually a photo of that ora, not during that particular inversion, but this is during that inversion. This is what it looked like at noon in Donora, October 29th, 1948. It was just awful. Half of the community, half of the city got sick. Many of them died. I actually work with a woman, her grandmother died as a part of this episode, Deborah Davis, and she was actually raised there at the time, continues to do this work. The concern was, man, if we had an episode like this happen in a big city, thousands of people would die. And several years later, 1952, London, England, had a bad episode, just was awful. These are daytime pictures. Thousands of people died in a 4 or 5 day episode, and in fact, we're still studying this episode. The estimates are somewhere between 8,000 and 20,000 people died as a result of that severe air pollution episode. So we have those episodes in Meuse Valley, Donora, London, England, that leaves absolutely no doubt that at extreme concentrations of air pollution, you have substantial excess disease and death. Now, as a result of those 3 episodes, we have had some action, some public policy action. So you had the killer smog episodes in the 30s, 40s, and 50s, and then we began to get legislation, and Jaron's already talked about this. We had the Clean Air Act amendments that actually ultimately resulted in the creation of the Environmental Protection Agency and the development of these national ambient air quality standards that have been discussed. And as a result of that, really by the 1980s, these so-called killer fog episodes had largely been eliminated in the US and in the UK. And many people, many scientists included, thought that maybe the air pollution issue has been solved. Well, this leads us back to this very valley. We have this valley that is a bowl, like Jaron's talked about. You have this inversion that almost, sometimes, not always, but when we have these inversions, it's like putting a lid on the bowl. And the pollution builds up, and you get these high concentrations of air pollution. It's basically a natural test chamber. Okay? We have a test chamber over in Jaron's lab where we put subjects and put air pollution on them and things, but we have to get human studies review, IRB approval to do that. Nobody was doing that here. We were just taking people in Utah Valley in their natural test chambers, putting a lid naturally on them and getting massive amounts of air pollution. Geneva Steel contributed substantially to that. The good news is we were monitoring air pollution for quite a long period of time. And Jaron's already shown some of these slides, but think of this. We got this natural exposure chamber, and we put a lid on it. And air pollution goes up. We take the lid off, it goes down. Goes up, down. Isn't that neat? It's great for us researchers, isn't it? It's a natural chamber. And then what even happened, now I have to go back and use PM10. Jaron has shown this already, but not only that, we actually had a natural experiment in the sense that we turned off the air pollution, or at least about 60% of it, for about 13 months. Geneva Steel shut down. Remember, USX shut it down. They left it on hot idle. Then Joe Cannon and his group came in and bought it and opened it up 13 months later. It's one of the neatest natural experiments around. Now you're saying, why should he take such glee in sick babies? I don't take glee in it. That's what happened, though. We had a bunch of mothers. Where's our mothers for clean air? We had a bunch of whacked out mothers back then. And what were they saying? They were saying, little Johnny got sick. And when Geneva Steel closed down, he got better. And then little Johnny got worse when Geneva opened up again. And Sam had it about right. The truth is I didn't really believe this. I thought the mothers probably had it wrong. It was just blaming somebody. And but they did hold that meeting. It motivated me to retrospectively collect air pollution data and pediatric respiratory hospital admissions data for the area. And here's what we found. This is Geneva still open, Geneva still closed, Geneva still open. This is just mean PM10 levels. Look at bronchitis and asthma for children. Geneva still open. Wow. Not all the little Johnnies got better, but most of them did. And then it reopened, and they got worse again. Pneumonia and pleurisy, total respiratory disease. It was a stunner. Did a couple of analyses of these data and related data, and it became absolutely clear that Utah Valley was a relatively unhealthy place to live, with Geneva still polluting, and especially during the inversions. It also became apparent that it was a remarkably interesting place to study. And I actually began to study with collaborative research with a whole host of researchers, Joel Schwartz at the EPA at the time, Doug Dockery at the Harvard Medical School, David Bates at University of Washington at British Columbia at Vancouver, and a number of others, some that aren't there. And there was almost a convergence of researchers here to Utah Valley, because this is such an interesting natural exposure chamber with massively high levels of variability in terms of exposure. We look out here today and we say, wow, it's gorgeous. And it is. It's clean out there today. But there'll be other days when it isn't. And that variability is precisely what is very useful to help study the health effects of air pollution. And so myself and a number of colleagues spent several years focused primarily here on Utah Valley doing a number of studies. And we found that increased exposure to fine particulate air pollution in the valley was associated with increased hospital admissions, increased respiratory symptoms, and reduced lung function, increased school absences. And stunningly enough, we even found that it was associated with both respiratory and cardiovascular disease death. There were some that thought, that's just epidemiology. And there was a group of, primarily from the EPA, of toxicologists that came in, and they took archived filters for the time period when Geneva Steel was operating, closed, and then after it reopened. And they took particles off those filters and they instilled them into the lungs of volunteers. You're thinking, wow, a lot of nerve, right? And they did that with rats as well, and then in these in vitro studies.
Undergraduate students.
Yeah, some were poor grad students too. They were at Research Triangle Park, so they had Duke. There were no basketball players on it. Duke, NC State, UNC. But you're right. Undergraduates, I've unfortunately used them myself. But what do you do? What do you find? Experimentally, the particles from our air had measurable deleterious effects on human lungs, rat lungs, and tissues in experimental settings. No doubts. There's really no doubts anymore that the air pollution in the valley has substantial health effects. Now, it was controversial at the time. I just pulled up a couple of New York Times. Utah mill lies at the heart of the fight over air pollution. Provo, Utah, in the Wall Street Journal, provides combatants in clean air fight. Sam Rushforth should have, a big picture of him and Joe Cannon, battling each other. That wasn't, the picture wasn't in there, but it should have been, right? So we started a whole series of studies throughout the world, a whole bunch of these what we call daily time series and some case crossover studies where you look at day-to-day changes in air pollution and day-to-day changes in mortality counts. And now these have been done in hundreds of cities throughout the world. I'm just showing some meta-analyses, that is, summary analyses and estimates from large multi-city studies. And the bottom line is for every 10 micrograms per cubic meter increase in PM2.5, or 20 approximately micrograms per cubic meter of PM10, we see about a 0.5 to 1.5% increase in death, in mortality. Now, 10 micrograms isn't real big. Remember, in 1985, we had one day where we had 365 micrograms per cubic meter. Last winter, we were getting, what was it, Jaron? We were up around 80 or 90, was about the highest we got. So this is, 80, 90, it's just 7, 8, 9, 10% increase risk of dying, which is not trivial, obviously. I left Utah to go to Harvard in 1992 and 93, and I'd already been working with this Doug Dockery and Frank Spicer on a number of studies here locally. But I went there, I took a fellowship at the School of Public Health. And one of the first projects I worked on was what's called a prospective cohort study. Doug and Frank Spicer and Ben Ferris and a few others had been following a cohort of individuals living in 6 U.S. cities, following them up. They'd measured for 14 to 16 years. They'd monitored particulate pollution and various other pollutants. And then what I did is I took that data and I analyzed it using what we call survival analyses, Cox proportional hazard regression modeling approaches. And this allows us now to control for individual differences in age, sex, race, cigarette smoking, and various things, just to give a feel of how this study's set up. So these are survival curves. So what happens is at time naught, this is the time of enrollment, we enroll people in 6 different cities. 2 highly polluted cities, Steubenville, Ohio, and St. Louis, Missouri. 2 clean cities, Topeka, Kansas, and Portage, Wisconsin. And 2 sort of moderately polluted cities, sort of in the middle, Kingston, Harriman, Tennessee, and Watertown, Massachusetts. We enroll them at time period naught, and you can see at time period naught, 100% of them are alive. In fact, that was a condition of enrollment, all right? We enroll them, we follow them up over time, and you can see that the survival curves are splaying out, meaning what? They're dying more rapidly in the in the dirtier cities than in the clean cities. Now you say, maybe it's something else, so we'll model this in a more sophisticated way. So we're going to do these Cox proportional hazard regression models where we control for age, sex, cigarette smoking, and a whole bunch of other factors. And now we're plotting those adjusted rate ratios or risk ratios for mortality for the 6 different cities plotted over their pollution levels. And look at that. It looks nearly linear. In fact, it looks like we cheated, doesn't it? We didn't. You can look at this another way. So what I've got here is adjusted risk ratios. Think of this as relative risk for all-cause mortality, lung cancer, cardiopulmonary mortality, and all other, for an average smoker as they enroll in the study. And man, smoking is bad. Make no doubt, there's no doubt about it. Smoking doubles your risk of dying. Lung cancer, 8 times as high. Cardiopulmonary, 2.3 times as high. Smoking was bad. But look at air pollution, 26% higher, 37% higher, etc. Now, that's not as bad as smoking. But it was strange if you think about it. Back then, an average city in the U.S., what was the percent of the people that smoked? About 25, 26%. In those same cities, what was the average number of people that breathed? If you think about it, this is an increase in risk of 100%. This is an increased risk of 26%. This 100% is applied to 26% of the population. This 26% is applied to 100% of the population. In a heavily polluted city, these estimates suggested that the absolute value in terms of the number of deaths from air pollution was almost the same as from smoking. Not to an individual. To an individual smoker, the risk was substantially higher. But to the community, the health impacts were substantial. Crazy, isn't it? And furthermore, the exposure is largely ubiquitous when it comes to air pollution, and it's not voluntary. Okay, well, we didn't believe these results, frankly. None of us had the nerve to lick the stamp and send it off to a journal. We wanted to see if we could reproduce it. We had a friend, Clark Heath, with the American Cancer Society, Michael Toon, also at the American Cancer Society. They had been following up a cohort of 1.2 million people. That's bigger than 8,000. 1.2 million people, called the American Cancer Society Cancer Prevention 2 study. We asked them, could we link our air pollution data with your data and analyze it similar to what we did with the 6-city study? We eventually did that, and just cut to the chase. Same sort of analysis. Ran this analysis on the mainframe computer with the CDC down in Atlanta. Took a lot of work back then. What do you see about cigarette smoking? It's still stupid. Yeah, let's face it, it's not healthy. All right, pretty bad thing to do. And what do you see with air pollution? What do you see? What about breathing? It's still, well, you better breathe, but it increases your risk of dying. I know. Well, we published these 2 studies, and of course, after we had them both, we published this. This study was published in the New England Journal of Medicine in '93. This paper published in the American Review of Respiratory and Critical Care Medicine in '95. They raised a lot of concerns, and in fact, the industry groups just threw fits. Just for example, shortly after, they were accused of being junk science, secret science. Industry and environmental researchers are squaring off over studies linking air pollution and illness in what some are calling the biggest environmental fight of the decade. Well, we were threatened with a congressional subpoena and other things if we didn't turn the raw data over. It was actually illegal to turn the raw data over because we had confidentiality agreements, as required by IRB approval, to we had to protect these data and the subjects. Eventually, what we did is we turned the analytic data sets over in a controlled way to the Health Effects Institute. And over a period of about 3 years, they had Dan Krusky, Rick Burnett, Mark Goldberg, and 26 others spent about 3 years auditing, reanalyzing, and doing sensitivity analyses on the Harvard 6 cities and the ACS study. And finally, in July 2000, they came out with a report that basically got the same results we got. And in fact, the results were more robust. They were able to do more things with it than we could, but the results were remarkably robust. Roughly at the same period, there were these lawsuits against the EPA for the standards that were being established based largely on these and the related studies. In 2001, there was a unanimous ruling by the Supreme Court that basically largely resolved the legal uncertainty with regards to the new PM 2.5 standards. Then shortly after that, I began working with some of the primary researchers, Rick Burnett, Dan Krusky, some of the primary researchers on the reanalysis. Rick Burnett and Dan are both superb statisticians, had developed several techniques that did a better job of analyzing these data. Furthermore, during this time frame, we've been following up that ACS cohort for many more years. The number of deaths has roughly doubled, and the inferences that we can make are now quite a lot stronger. We reanalyzed the data with a substantial extended follow-up, published this in 2002 in the Journal of the American Medical Association. Basically what we found is that all-cause mortality, the risk of all-cause mortality goes up as exposure to PM 2.5 goes up. That's driven largely by cardiopulmonary mortality, that is cardiovascular and respiratory disease mortality. but we also found, this was the first cohort that was large enough with a long enough follow-up that even after controlling for cigarette smoking, you could see the association with lung cancer as well. All right. Now, the lung cancer effects are still dominated by cigarette smoking, but in a large cohort, you can actually see the effects even for air pollution. We reanalyzed these data focused on LA area. We had enough participants in just the LA area that we could look at intra-metro LA variability and exposure. We also did a study where we tried to focus on the epidemiologic evidence of general pathophysiologic pathways of disease, trying to figure out what's going on. And what was stunning is that most of the deaths were cardiovascular deaths. Not respiratory like we expected, but cardiovascular deaths, ischemic heart disease, dysrhythmia, heart failure, cardiac arrest, and related cardiovascular disease deaths. So, without going into more details with regards to all of that epidemiology, I'll just simply say, wow, it was crazy. It was really hard to imagine, at least for me, that starting out with a couple of hysterical mothers thinking about respiratory health in children. Turns out you guys were right, right? Those mothers had it right, but they didn't even understand the entire effects, because it wasn't just children and respiratory disease, it's all of us in our cardiovascular disease, at our cardiovascular health as well. And in fact, well, you know, when you know, we published this one paper with John Godleski. He's a pathologist at the Harvard Med School, and after we published this paper, there was, you know, of course, a lot of press about it. Air pollution in U.S. cities causes twice as many deaths from heart disease as it does from lung cancer and other respiratory ailments, etc. Well, this causes some concern. You know, anytime you read in the paper or hear in the news about some new thing that's really good or really bad for your health, what should you do? Be skeptical, all right? I mean, I saw this report and I was skeptical, and they were quoting me. Can this really be true? Is it biologically plausible? If so, what are the pathophysiologic pathways that link breathing air pollution and cardiovascular deaths? Well, this is something that we've spent a lot of time looking at over the last several years. So, for example, I've done a number of studies where we looked at the effects of fine PM on the lungs, and we see that breathing pollution results in pulmonary inflammation, reduced lung function, increased respiratory symptoms, accelerated progression of and exacerbation of chronic obstructive pulmonary diseases. There's this fantastic study that's been done. It's often referred to as the Southern California Children's Health Study. I was not directly involved with this study, although I have consulted with a number of these folks. Basically, what this study does is it looks at the effects of air pollution on children's health, especially lung function growth. They followed children for a period of 8 years during the most rapid lung function growth period of their lives. What did they find? Deficits in lung function, FEV1, those with greater deficits in lung function lived in cities, in communities with more air pollution. It was that simple. Children's lung function growth seemed to be damaged by exposure to air pollution. They took another cut at the data, so this is looking at lung function and exposure to air pollution from traffic sources, focused on traffic sources, measured basically by how near to major roadways they lived. All right? So children exposed to more air pollution due to the fact that they lived near to roadways, major roadways, also had deficits in lung function growth. We also have looked at the effects of particulate matter pollution on markers of systemic inflammation and oxidative stress. We see that exposure to air pollution increases C-reactive protein, CRP, a measure of systemic inflammation. We see pro-inflammatory mediators, leukocyte and platelet activation, and increased blood coagulability associated with air pollution exposure. So as a result, we see effects of PM on the blood vessels, on the vasculature, if you will. We see endothelial dysfunction, atherosclerosis, both the accelerated progression and destabilization of atherosclerotic plaques. Therefore, it's going to affect the heart. And we see increased ischemic heart disease, especially MIs. We see changes, we see effects on the brain, including increased cerebral vascular ischemia, basically the most common strokes. Inexplicably, as a result of a series of studies that we've done, where we take ambulatory ECG monitors and put them on people, and then we analyze literally millions of ECG tracings electronically with the computer. What we found is that increased exposure to air pollution reduces cardiac autonomic function. That is, the ability of your heart to regulate itself. As a result, we now know that PM inhalation, whether it be breathing cigarette smokes or putting your mouth over the tailpipe of a diesel truck, that'll get you a lot of stuff, or just breathing air pollution that gets trapped in our valleys, impacts our lungs, impacts our body systemically in terms of inflammation and oxidative stress, and as a result impacts our heart, our vasculature, the blood, and our brain. Now, do we have time to cover? We got 10 minutes, right? A little more, all right. Because this story goes and goes and goes, doesn't it? It's hard to even keep up with it, but I'll just show you a little more. It's pretty easy to believe from a plausibility, biological plausibility aspect that air pollution might affect your lungs. How could it affect your heart? Here's what we think is going on. You get the fine particle exposure, results in pulmonary and systemic inflammation and oxidative stress. Oxidative stress and inflammation, along with blood lipids, and we've learned now that they work together. These are co-conspirators in terms of atherosclerotic related diseases. You get high blood lipids, high systemic inflammation, and you're going to get an acceleration of the progression and destabilization of these atherosclerotic plaques. All right? This has been shown in a series of studies by Stephen Van Eden and his colleagues at the University of British Columbia. They've seen that PM exposure results in pulmonary inflammation, the systemic inflammation responses. They see progression and destabilization of atherosclerotic plaques. And in rabbits, these specially bred rabbits that are naturally prone to develop atherosclerosis, PM exposure accelerated the progression of the atherosclerotic plaques and resulted in greater plaque rupture. Here's a fascinating study that was done by some colleagues at NYU. They took these hypolipidemic rats. Now these are often referred to as ApoE. These are knockout mice that are specially designed, genetically designed to have high levels of blood lipids. Okay, they're hyperlipidemic. Okay, so basically this is a model. This is a mouse model that's used to sort of look at what happens when you're exposed for fairly long periods of time. But because they're hypolipidemic, you get it's like they age fast. If you understand what I'm trying to say. So what they did is they took a group of mice and they exposed them to normal chow diets, so just normal diets. They also had half of them that they exposed to high-fat chow diets, okay? And then half of each of those they exposed to clean filtered air. And half of each of those groups they exposed to polluted air, PM 2.5, 8 hours a day, 6 days a week for about 6 months, if I remember correctly. The exposure they exposed them to is about 120 micrograms per cubic meter, roughly what we get along the Wasatch Front during our pretty bad inversions. All right? So this is environmentally relevant levels. And you can sort of see what they found. You can see, look at that. Do you want your coronary arteries to look like that or like that? What do you think, Doc? Yeah, actually, you're looking for a clean one, aren't you? Well, these are hyperlipidemic mice, but you know, this is pretty nasty stuff. Very, very bad. It's very clear that both high-fat chow diets and air pollution impact coronary artery health. All right. Now, nobody will let me do this with humans. We already talked about how we put the lid on and off this valley and that sort of thing, but I can't get IRB approval to do this with humans, nor would you want us to sacrifice humans to do this sort of thing, right? Undergraduate students. Sam, are you on an IRB somewhere? You know? But we can do various things. For example, I worked with a guy named, this is a pathologist down in Brazil, Paulo Saldiva. And what he had is he was doing autopsies there at the Faculty of Medicine hospital there in Sao Paulo. And you have people that come in that die of violent deaths, but they seem healthy. Most of these are car accidents, some murders and things. They seem healthy, but what he can do is he can take lung tissue, and we can look at various measures. And not only that, he reproduced their history of exposure. Were they cigarette smokers? Where did they live? Where did they work, etc.? And what we found is those exposed to more air pollution clearly did have more evidence of inflammation. And in fact, we had one marker called anthracosis. Anthracosis is, don't confuse it with atherosclerosis. Anthracosis is nothing more than seeing black carbon specks on the lung, okay? And you can think of that basically as a biomarker of exposure. More anthracosis, more inflammation. Now these were sacrificed, but accidentally, these folks. You can also do what's called carotid ultrasound to measure carotid intima media thickness, CIMT. This is a safe, non-invasive technique that evaluates the burden of subclinical vascular disease, basically atherosclerotic disease. Nino Koonsley in the LA area demonstrated that individuals exposed to higher levels of PM 2.5 pollution had more evidence of subclinical atherosclerosis as measured by CIMT. This is a study done right here actually mostly in Salt Lake with a group at Intermountain Healthcare. Jeffrey Anderson and Ben Horn and others. I actually was wanting to do a specific called a case crossover design. I'd been looking for an opportunity to do it for some time, and I saw in the newspaper a registry of their patients, of their cardiac patients, where they'd done an entirely different study, not related to air pollution at all, but I thought, that's a great registry. That's one that we could use for air pollution. So I contacted them. We initiated this project where we took about 13,000 well-defined and followed-up cardiac patients who lived on Utah's Wasatch Front and who went coronary angiography. Basically, you don't have to sacrifice them. What are you doing? You know, you medical folks know, you see this all the time. It's great. You can actually look at their coronary arteries to see if they have any occlusions, to look for atherosclerotic lesions. And what we did then is this case crossover design that I won't spend time talking about, but in essence what we found is that for all acute coronary artery events or ischemic heart disease events, including unstable angina, the index MI, the subsequent MI, for all of those, the day of and a few days preceding the event, air pollution increased the risk of having these events, and especially in those that had existing coronary artery disease, those that had one or more coronary vessels that had atherosclerotic lesions already. And we did a similar sort of study with roughly the same group looking at heart failure, and what we see is that we see increased risk of heart failure with a longer lag structure. I'm going to skip this. All right. Well, what does this mean in terms of public health and benefiting public health? Well, one thing that we can do, we can take, say, the Harvard Six-City study or the ACS study, and we can take those excess risks, and we can use standard life table techniques and generate survival curves from birth till death for people living in clean cities that never smoke, or people living in clean cities that smoke. And incidentally, what's the law? And then you can calculate the difference in life expectancy. What is it about? About 8 years. About 8 years loss of life expectancy. What about being a non-smoker but living in a polluted city? About a year or so, or two, loss of life expectancy. Now we say, well, can we estimate that directly? The answer is yes. Just last year we published a paper, Doug Dockery, Majid Azadi, and I. Basically what we did is we had 51 metropolitan areas for which we had matching air pollution data in the late 70s, early 80s, and then in the late 90s, early 2000s. So we have roughly a 2-decade period, 1990s and 2000s, where we have matching air pollution data. We calculated for 211 counties, we computed the life expectancy in those counties in these 51 metropolitan areas. And then we looked at the air pollution changes. Now the idea here is that what we have is a great big national natural experiment where, based on the Clean Air Acts and the National Ambient Air Quality Standards, time out, what did we find? Cities that increased their air quality, i.e. reduced their pollution, had more rapid increases in life expectancy than those that didn't. I'll just close, well, not quite close. A 10% decrease in PM 2.5 was associated with about a half a year to a year increase in life expectancy. To help put that into perspective, there probably wasn't any single medical intervention in that time frame that would have done the same thing. The closest is the reduction in cigarette smoking. In fact, that was probably even more important because we were reducing cigarette smoking during that time frame. All right, Sam, give me 1.5 minutes. 2.5? I should have. There are two criticisms of these studies. Actually, there's lots of criticisms, but two of the biggest criticisms are this. One, these effects are too small to matter. That's nonsense. I won't even do it. The other one is, these effects are too big. They can't be real. Literally, that's the two major criticisms. The argument that they're too big is this. Look at, cigarette smokers have a risk of dying roughly double from smoking, but their exposure is way more than double than what you get from air pollution. Just to kind of put that into perspective, the idea is this. This is a pack-a-day smoker with a relative risk of about 2, but their inhaled dose is about 240, not micrograms, but milligrams per day. This is living in a polluted city or living with a spouse that smokes, so getting exposed to secondhand smoke. And the exposure is so small it looks like it almost sits on the vertical axes. Yet we get an increased risk, not of 100% more, but of 20, 30, 40% more. And if you do a linear extrapolation from this to here through the origin, this looks like it's a much bigger effect than would make sense. And it's true. It's too big if you assume a linear exposure response function. The problem is it's not linear. If you actually look at smoking, you look at exposure from smoking, from different levels of smoking, it's clearly not linear through the origin. And if you look at the exposure response relationship plotted over the log linear dose, fits pretty good. Bottom line, breathing fine particulate air pollution, primarily from combustion sources, increases your risk of both respiratory and cardiovascular disease. Thanks. Oh, I want to say one more thing. Our efforts to improve our air quality, therefore, does what? Helps us live longer. And that's not a bad thing to do, is it? Thanks.
we'll ask both speakers to sort of be open for questions as you have them. And please take a break. There is coffee, soda, cookies, and other things in the back. And we'll convene again in roughly 20 minutes.
Yes.
Dr. Lynch has a Mac.
Okay, do you have your adapter between the two? Great.
And we should be just fine.
If we could get you to put this on too when you get ready. Okay, super. Yeah, right down here.